for you. Okay, now today I'm presenting this seminar. This seminar is economic evaluation of university training doctors in Mozambique. First, just say you thank you for coming. This part of this project I have been doing at the University of Southeastern of Norway, so that's the reason that I put it here. I was working there since August of last year to January, to the end of January of this year. And I have worked with Luis Lopez Rivero, who is the manager, the director of the project. And Coraima Clavijo Sanchez, that she must be here today, but she is not. She is a student at the master in the TEDx too, and she has been a student in at the faculty in economics, and she was working in this study for her dissertation in the graduate of economics last year. Okay, this project, really the need of this project started in 2009, when the rector of the Unisambese, which is University of Mozambique, one public university in Mozambique, he asked for help because they have started that year in 2009 a new faculty of medicine in the north of the country, in a small province of the north of the country, which name is Tete. Tete is around 2 million people, 2 million population, sorry. And he asked for help because they only had teachers for the first 3 courses of the Faculty of Medicine, but they don't have any teachers for the second part, because in Mozambique they need a specialist to teach in the second part, the 4th and the 5th course of medicine in Mozambique. So they asked for help, and then Luis Lopez Rivero, who is a professor, associate professor at the University of Las Palmas, and he's a doctor at the University Hospital of Gran Canaria. Then he organized people. He organized teachers of the University of Las Palmas, and mainly doctors and nurses of the healthcare system of Canary Islands to move to Mozambique to teach there, and they did it since 2012, and they did it like in the way that they go there and everyone stay there 1 month, and they teach in an intense way, like they will be teaching for 4 months. They did it for 1 month, but in that way. So many people go every year to Mozambique to teach there and come back. And many of them, they did it in their holidays. So that was part of their holidays. And they did not receive any payment for that. They just did it altruistic. So this project the reason of the project is training students that at the Faculty of Medicine, and this project, the professor of the University of Las Palmas and the doctors of the University Hospital, they teach in the 4th and 5th course of the Faculty of Medicine there. So this project has effect on the health, but also in the education system of the country. Okay, it's not only producing doctors; it's producing human capital too in that country. When you are training doctors in the faculty, they are upgrading the level of human capital. And what is very clear, and is there are many works in the literature about this, is that when you raise the human capital level of a country, then that country have strong effects, will have strong effects in the economic growth, but overall in the social welfare in that country. That's something that I'm working to at this moment. And the reason is that you distribute better the richness and the quality of the richness in a country when you develop the human capital. And of course, when you develop the human capital, you will have people that they are able to choose and ask more to the politicians about the politics of that. So that can be one effect of this project. And this project was supported by the Spanish government, the AICID, that is the International Agency for Aid in Spain, and for other many private companies and public institutions in Canary Islands too. Just have a look about what is Mozambique. Mozambique, well, first Mozambique was a colony of Portugal for 500 years, and they get the independence in 1975, more or less like the same in Spain. But after that they got a strong civil war, and the civil war was finished by 1991 approximately. They are 29 million population, and just have a look on this. The GDP per capita is $488 per people, but they are extremely rich. The country is extremely rich because the country has gold, diamonds, gas, oil, wood, fish, but people is extremely poor. And this is a photo that I took with my own phone. I was in Mozambique in January of 2019, and this is a very good street of this country. So, but what you see here is that there is not this dirty, there is not pavement here. It's just dirty people is walking without any type of shoes. That is, there are a lot of garbage everywhere, and that's the condition of the country. And even you can find many beaches, very nice beaches around this city, which is Beira, but even you cannot touch the sun because the sun is polluted, because there is not any system to clean the water, the dark water of the city. So you cannot go to swim in the sea, you cannot touch the sun because everything is contaminated. So this is the life expectancy is 58, but where it was 58 years old, but in Tete, where is the project developing, the expectancy of life was 52 years old. Okay, so 52 years old. People die very young. What I'm presenting today is economic efficiency analysis and an economic evaluation analysis too of the social welfare generated by this project during this time. So how I explained before, what is doing here, it was doing here is that the Mozambique teachers, they teach in the first one, second and third course of the Faculty of Medicine, and the professors and the teachers of the University of Las Palmas and the doctors from Gran Canaria, they teach in the fourth and fifth. But later, because the faculty growth in number of students, they need to contract more teachers for the first, second, and third course, and they contract Cubans professors. There is a lot of Cubans doctors working in Mozambique, at the same as North Korean doctors too, and they contract Cuban teachers to teach in that courses to support Mozambican teachers. I need to see it because now it appears many data and I have to follow the note in order not to lose myself. And what we'll see here is that the aim of this project is just, at the beginning they need help to teach in the faculty, they need help to teach in the first 3 courses, they need help of Cuban professors, but in the second part they need help of Spanish teachers. But the aim of this project is try to substitute this foreign help of Cuban and Spanish for just teachers, Mozambique teachers, and this is the aim of this project. So this project is giving this country independence in the future. They will not depend more in the future of these Spanish Cuban teachers. So this is a sustainable policy. This is a new type of policy, because normally in aid, international aid, what you have is that, okay, we need to help these people, these Mozambicans, that they are dying for many different things like cholera, like other virus, they die a lot. So we send doctors there to help them, and we pay these doctors that came from Europe or United States or developing country, and this is the normal, the regular type of aid that they receive. But this is another type of aid. This is an aid that they have received for 10 years, and later they will not receive more because they will not need more, because they have now teachers that they are completely independent. So this is like a sustainable policy in that way. Here is, in this photo, this is Luis Lopez Rivero in one of her lectures there, and this is another Spanish doctor teaching. So this is one photo of the, I think this photo was in 2013 approximately, and this is a photo of the first group of graduate students, new doctors that was graduated in 2013. And just have a look on these figures. As I told you before, the population of Tete, where is the faculty located, it's 2 million people. And for 2 million people, they had 100 doctors. So that's extremely, it's like one doctor per 50,000 people approximately. So you can imagine that for the whole Canary Islands, that we are approximately 2.2 million people, there are only 100 doctors. That's interesting. So that's what they had before. And this project, in 10 years, they had added to the system, we have added to the system 199 new doctors. And probably in the first 4 or 5 years, there will be 100 more. So in 10 years, we double the number of doctors in the area, and in 4 or 5 years more, we will multiply by 3 the number of doctors. So the impact just on the health care system is quite strong. So there is an impact on the healthcare system, but there is also an impact in the education system. Okay. And now the project has completely finished this year. So there is no more Spanish teachers teaching in Tete. They are completely independent now. But now there is a new project. And the new project is developing in collaboration with the Catholic University of Mozambique, who is located in Beira. Beira is, I think, the second highest city of Mozambique, and in collaboration too with the University Hospital of Beira. Okay, so and now the new project is they are training specialists. So most of these people that they are here, Luis Lopez Rivero is here, me is this one. This photo was last January of 2019. Most of these people was people that was trained in Tete, and now they have started to be trained like specialists in this hospital. Many of them came here to spend several months in the hospital of Gran Canaria too. So, but that's another type of project. That's a new project, I mean, because you have to remember that to teach in the second part of the graduation, and the fourth and fifth course, they need to be a specialist, and at this moment they don't have it. Okay, so they need to. So that's the reason that this is the second part of this project: teaching, training specialists to improve the healthcare system, but to improve the education too, because they will teach in the second part of the graduation. And these figures summarize like how has been developing the faculty since the beginning in 2009 to last November, when the course finished. The course finished in November and start in February every year. So at the beginning it was 49 students in the faculty. So they start with 49 students in 2009, and 21 teachers. Everyone was from Mozambique. That was the beginning of the faculty. And just in 2011, they add Cuban professors to the staff of the faculty, 6 Cuban professors. And then they start to grow in number of students. Even here, in 2015, they were 350 students, and in 2016 they were almost 400 students. And do you remember they start 49? This is because I don't have data here exactly. It's not easy to get data from Mozambique. You can ask for the number of students and you have to wait 1 month to receive it, but at the end you receive it. Okay, so but what happened here is that you can see that you can think, okay, but if this class is a fixed cost because you have 1 teacher and you can have 50 people, or even you can have 60 or 70, and the marginal cost is 0 if you add new students. So what happened here was that the government cut the number of students. that could be enrolled in the faculty, and that's a politic decision. When I was there, they told me, doctors, I will not come back to Mozambique, so I can say this. They told me, doctors here have strong power, and they don't want to lose that power, so the government cuts the number of students, and this has had a strong effect on the efficiency of the project. Because what we are looking is that we put a teacher and we can add more students, and then the efficiency will rise, will improve. But if you have that somebody is cutting the student outside, then the efficiency goes down. Okay, and we will see this later. So here, the first teachers of Spanish teachers start to teach in 2012, and they were 13 at the beginning, and then they add more and more, and then they were like 37, 36. And this year, last year, 2019, they only taught in the 5th course, so that's the reason that they were half people, because last year they taught only in the last course, and then they leave it, the faculty, completely. But because they didn't have specialists to teach, they need to contract Cubans as a specialist to teach in the second part. This will be important later when we will see the figures of the efficiency. We have here the number of hours teaching for every type of group. And here we have the first course, it was 960 hours, so this means that every course have this, and there is only one group per course. And then you have 2 courses here, and then you add more, and then these are the hours of Mozambique teachers teaching every year, and these are the number of Cuban professors. So they start to teach in 2011, and they start teaching 1,488 hours. But here, in 2013, 2014, they are more people to the system, and even here too in 2015. So here, 2013, 2014, and 15, they got a high number of Cuban teachers, and then, yes, in 2016, when the first group of graduate doctors that was graduated, that they were graduated in that faculty, they became to teach in that faculty, then they were able to contract less Cuban and substitute Cuban teachers by Mozambican teachers. So, and that happened in 2016. Okay. But still they keep some Cubans until this moment. In 2019, when in that moment they didn't have any Cuban professors in the first 3 courses of the faculty, and they contract 4 for the 4th and 5th course of the faculty. Okay. So last year, only Mozambican teachers support all the teaching in the first 3 courses. And we will see how this affected the cost of and efficiency of the project. And here you have the number of hours of the professor, of the teachers from Spanish. And here you have the number of hours teaching during these 11 years, 20,800 hours of teaching. And in the second part of the graduate has been, until last year, 14,400 hours of teaching. Most of this has been by teaching by Spanish for free. And here you have the cost of everyone. This is the annual wage salary of a Mozambican teacher, and this is the annual salary of a Cuban teacher. Okay, so they receive like 2,000 euros per month approximately, the Cuban. 1,000 euros is for them, and 1,000 euros is for the Cuban government. But in addition, they receive money to buy a ticket and to get an accommodation in Mozambique. So it's an extremely big difference. They are quite expensive for the country. You have to remember that this is more than 2,000 euros per month, really, in average. And you have to remember that the GDP per capita is for 1,800. So they are extremely expensive for them. So this is an effort of the Mozambican government too, that they are doing this. And the Spanish teacher, they don't receive any salary, but they have paid by the accommodation, and the accommodation is paid by the Mozambican government, and the transport, the insurance, and all the expenses that they have for food and everything is paid by the Spanish government. And this is the cost per teacher annually, okay? But what I add is the following. Okay, even if they don't receive a salary, a wage for their work, their time has cost. So I add a second scenario where I'm evaluating the project with the opportunity cost of Spanish teachers, because it's time that they are using, even if nobody is paying that. And here, what we have is we are able to calculate the average cost per hour for Mozambican teachers is around 24 euros per hour, and you have the cost per hour of a Cuban teacher is 114 euros. So you are able to calculate the cost for each type of group of teachers, okay? And this is the total cost. This is only for the first cycle of the graduate, and you have here the cost for every year in the first cycle, the first part of the graduate. And this is for the second part. this is the cost, average cost per Spanish teacher, 34, so it's close to the Mozambican, but much more lower than the Cuban. And this is the cost if you add the salary of this teacher, and then you get like similar to the Cuban. And this has this summarizes how has the cost developed, the total cost of the whole faculty developed in these years. So they start spending 23,000 euros, and even they got 362,000 euros in 2014. But here, after that, they start to substitute Cuban by Mozambican teachers, and they start to go down in cost. Okay. So this is in this course they get they taught only with Mozambican teachers in the first cycle and 4 Cuban in the second. So in the future, what we'll be expecting is that the cost will be around these figures, okay? But in the middle, they got a big effort to build this human capital, okay? They had to pay higher cost to get to put these people, to train these people, and to make them be able to teach in the faculty. So, at this moment, there has been 5 academic promotions, completely graduate. The first promotion that started in 2009, and the promotion that started in 2013. So they have graduated 5 academic promotion. This will be graduated this year, at the end of this year, 2020, and this 21, and this 22. Okay, but I only have calculated the cost of the first 5 courses, because in the 6th and 7th year, in the 6th year they only receive very small seminars, and they mainly work in the healthcare system. And the same in the 7th. So I did not calculate that, because it's not part of the project. Okay, that's something that is covered by the government. This is the global cost without wage for the Spanish, and the first group of students, of doctors, the cost was 167,000 euros. That was the cost for the whole promotion of 25 people, I think. I'm not sure now. And here you have the cost of the promotion of this year. Okay, that they start in 2013, and you have to remember that in that years there were like 10 or 9 Cuban teachers teaching at the same time, and they have a high cost, okay, individually. So that's the reason that the cost increase very important here. But now, when they start to substitute, they start to go down in cost. And even in 2021, the cost of the 5 first courses of that promotion will be only 260. But in the future, it will be even lower. It will be it will be 107,000 euros. This will be the tendency in the future. And this allows us to calculate which is the cost of training one enrolled student. And they start with 4,000 euros per enrolled students. They got even 7,000 in this bad, high expensive group. But in the future, they will be like here. That is 2,897 euros approximately. So in the future, each enrolled student will be around 3,000 euros. So with 3,000 euros, you have a new doctor. How much you have to pay for a doctor who is flying from Europe to any African country for 1 month? Only the wage can be for sure more than that. But in addition, you have to pay the transport, the accommodation. So this is much more rating for the country. This is much more profitable for the country. Produce training doctors than send doctors to help, because that is only for 1 month. And this you will have it for 40 years. And in addition, you are increasing the human capital of the country. Okay? Of course, in the present you need both systems working at the same time, because people need help now. And this, how you can see, this needs 7 years at least to produce one doctor. So this is like a long-term policy of aid. So I calculated, because the cost per student enrolled depend on the number of students enrolled. If you can have 75 students in one classroom, or you can have 25. If the government say, okay, this year will be only 25, and then the cost per student enrolled can be in the future between 1,500 or 4,600. Well, I will not continue with more data. I have more even in the analysis. This will be a paper that we are trying to publish now, and you will be able to read it there if you want. But in addition to this efficiency analysis, what I did was a real economic evaluation analysis. So I calculated the social welfare for the society. Okay, the costs are clear. We have seen it, which are the cost of training a doctor in this faculty. So, and this is the cost, for 7 years, and the cost without wage of a Spanish teacher and with wage of the Spanish teacher. So you have here the cost of the first promotion, for example, the second, the third, and the fourth. Okay. And what happened is that if you look to the average salary, of any worker in Mozambique, the salary is 50 euros per month. €50 per month. But the salary of every new doctor graduated in this faculty will be 800 euros per month. Okay? So that means that the benefit for the society will be even higher, because this is what they are paying, but what they are willing to pay is even higher. It can be even higher. So what I think is that okay, I have to calculate the social benefit of these people for the society. I calculate it in the way that how much people is able to pay, how much people they are willing to pay for them, and at least they are willing to pay 800. So they are willing to pay at least this difference. And they have been, and they are willing to pay this difference just for at least 40 years. For example, this can be, they start in 2009, and here they have costs for 6 years. ¿De acuerdo? And then, in this moment, the doctors start to work in this healthcare system, and they start to get a salary of 800. But the benefit for the society is the difference between what they are willing to pay in comparison what they are paying before. And they will do it for 40 years, so they will do it like until this. So what I have to do is actualize these figures for 40 years. Okay? That's the income. And these are the cost. And this is what I have done it here. So I have the benefit. This is the cost actualized with a discount rate of 2%. And I have here is the gross social benefit actualized with a 2%, and then what I have here is the net benefit for each promotion, so taking out all the cost of teaching without and with wage. So this is the benefit, the social net benefit for the first promotion without wage, and if we add the 5 promotion, at this moment, the benefit for society has been 53 million euros. And I think that we can have a look on the PIP. No consigo subir las transparencias. The PIP was 4,300 euros. So that's the PIP for 4,300 million of euros. And they get only with 5 promotion 54 million of euros. So it's a strong benefit for the society. Only with a small faculty with 20 people. Okay? Okay, and that's all. Thank you so much for